as the AFT, we represent over 200,000 healthcare workers. They were there for us each and every day, risking their lives, their health, and the lives and health of their families. And the only thing they ask of our government is to get them some PPE.
It is atrocious that in this day and age, 7 months into this pandemic, that we are still talking about the needed PPE. This is what workers are facing every day on the front lines, and we're almost numb in some ways as a country to it, and that should not be.
Because our federal government has failed to invoke the Defense Production Act, Ohio nurses have had to rely on other sources to obtain the protective equipment to safely provide care.
Listening to Rick and listening to Lisa and others, hearing the cries of our nurses, we spent hours and hours and hours sourcing these, trying to find N95s, trying to find masks.
We have had to reuse many different materials that before the pandemic would be a one-time use.
I think bringing and giving us this PPE equipment, the N95s and the surgical masks, it really shows that the AFT, cares about us at ground level, so that we can continue to take care of our patients.
What else should we be doing in terms of, nurses on the floor?
People are not as scared as they were when they first came.
I feel so fortunate to be a part of the OSUNO, and I know that what we have is because we have such a strong union and such strong support.
We know that Joe Biden and Kamala Harris they have a plan for adequate testing, a plan for supplies, and yes, for PPE to keep workers safe.
I'm very disgusted, and I voted already. I've been doing my part to remind my coworkers to vote because it's so important.
At the end of the day, that is who union is. It is about having people's backs. It's about making sure that safety and health is front and center. It's about honoring these amazing healthcare workers.
The union has been amazing. I have felt so supported, reaching out to me, asking if I need anything, but also knowing that they have our backs and they support us, and knowing that they will fight for what we need, the protection, so that we can take care of other people, because that's what we want to do, and that's why we're nurses.